Hello. So I was born and raised in Boston, the only child to immigrant parents who migrated here from West Africa in search of greater opportunity. And growing up, I felt fortunate to live in Massachusetts. Not just being in the United States, but specifically being in Boston, because residents always emphasized how the area was home to wonderful schools, medical institutions, and near universal health insurance. But there was a chasm between this perception of life in the Commonwealth and my personal lived experience. And for a while, I was very confused. But as I got older, I was able to learn more and see more, and I eventually learned about what disparities are. I started to fully grasp what they were when I took a class in undergrad and became aware that growing up in a community, for example, with a high prevalence of fast food establishments but not many gyms, or low literacy in education and high crime, how all those things were problematic for a community. And beyond that, I learned about additional inequities, including disturbingly high maternal mortality rates, especially among black women, and the ideology of healthcare as a privilege rather than healthcare as a right. And I felt like really frustrated, but I was also very intrigued and I became very invested and definitely discovered my passion and knew it was important for me to address disparities and do what I can to build healthy communities. I learned that social determinants, they have wide-ranging impacts. They affect health system costs, utilization, physical and mental health. This led me to spend some time working at Butler Hospital, a psychiatric hospital in Providence. I worked tirelessly to screen patients for health related social needs and to ensure they were connected to the appropriate resources, from housing support and education opportunities to much more. I enjoyed engaging in conversations with patients and learning more about them and working with other providers to make sure patient needs were being met. I eventually became very interested in what are lawmakers doing to address inequities. To explore this, I was granted the incredible opportunity through the Congressional Black Caucus Foundation to intern for Representative Karen Bass of Los Angeles. She led a delegation on a tour of Skid Row, one of the largest stable populations of homeless people in the United States. Tuberculosis, typhus, and hepatitis outbreaks are common on Skid Row, and I was shocked to learn that diseases that we sometimes refer to as medieval are circulating in the United States today. But I was even more disheartened to learn that in LA, African Americans represent only 8% of the population, but account for more than 30% of the homeless. My time on the Hill was incredibly formative, very eye opening, affirmed my passion for public health, and confirmed an intersectional approach to achieving health equity is necessary. All of this is why I'm pursuing a Master in Public Health degree, so I can learn public health concepts through the lens of disparities in access and be equipped with the expertise needed to become a trusted leader to positively transform communities near and far, especially the most vulnerable. Thank you again for this opportunity.